welcome to the Central Star Diagnostic webinar series. I'm Michelle Kaufman. I am the Customer Solutions Advisor for Central Star Cooperative, and I'm happy you're all here. So Central Star has a robust history of providing innovative solutions to dairy and beef producers. This new webinar series is designed to dive deeper into innovations that can help improve farm efficiencies, reduce labor, and ultimately lead to a more profitable operation. Today's episode, Eliminate the Labor Pains of Pregnancy Checks, will teach you the science behind milk pregnancy testing, how it can work on your farm, how to incorporate the test with a routine vet check or in the absence of an available veterinarian, and more. We'll start with a 30-minute presentation, roughly, followed by opportunity for questions and discussion. So to get started, I'd like to introduce our speaker. We had a last-minute change to the schedule, but I'm excited to bring you Dr. Jim Rhodes, the Senior Professional Services Veterinarian for the cattle business at IDEXX Laboratories. Jim graduated from the University of Missouri College of Veterinary Medicine in 1992 and the Executive Veterinary Program for Beef Veterinarians from Kansas State University and the University of Illinois in 2018. He's a Missouri native and practiced veterinary medicine in Missouri, with a focus on farm animals. Professionally, his interests are in both prevention of disease and driving production practices that are sustainable and profitable for the cattle industry. We're thrilled to have him with us today. So Jim, I'll turn it over to you.
Thanks, Michelle. So, Michelle, thank you for inviting us to be a part of your educational series here. And Dr. Paiva was originally set to do this, and American Airlines, and he had a different idea of what his schedule should look like for today. So I'm pinch hitting here. I hope I do Raphael's slides justice. Raphael and I do work together at IDEXX, but a little background. Raphael is also a DVM, but he's doing his PhD work right now at Texas A&M. And I am on his committee, so I try to agree with as many things as Raphael suggests because his ideas are fabulous. And several of his ideas are going to show up in the slide presentation today. A little background on IDEXX. I know most of you are very familiar with IDEXX, but as you see here, we got livestock into our purpose statement. But I have no illusion that we'll ever have the child hugging a cow. But I do like to think that they're staring at a cow somewhere over here in the snowstorm. But we all know that the companion animal drives a lot of what we do in animal health. But it also provides us a lot of help and resources. So when it comes to doing research and development work, I gladly take their help in the way of resources. We are a worldwide company. We do not put anything into animals. We don't have an antibiotic. We don't have vaccines. We don't have anthelmintics. We are a true diagnostics company. We started in 1984, and our first diagnostic test was in the avian industry. And we have grown from there, but our corporate headquarters remains in Portland, Maine, where the company started. With all that said about the companion animal versus the large animal sector, what we're looking at here is the relationship between spend on animal medicines and vaccines, companion animals versus livestock, in the chart on the left, but then the percentage of veterinary income derived from diagnostic income. And you see that the income being derived veterinary-wise from livestock testing is very small compared to companion animals, but yet the spend on medicine, so this would be dewormer vaccines, reproductive hormones, things like that, is quite a bit bigger than companion animals. Now, some of this we can't get rid of because it is synchronization hormones and things like that. But there's a lot of things that we could do here that would change the way we treat animals if we had some more spending on livestock testing. So it tells you that there's a lot we could do within the livestock sector as far as diagnostic testing. Speaking of that, IDEX, the milk pregnancy test, what is it testing for? It is looking for pregnancy-associated glycoproteins, three really big words, but PAGS is the acronym. And the really important part of this is it is a protein that makes it extremely stable. And the second thing is it is only produced, this protein is only produced in the placenta, in specific cells that are in the placenta. And the placenta is fetal derived. So if there is not a fetus or an embryo, there won't be placenta, and no placenta, no PAGs. So it makes this very stable protein a very specific marker for pregnancy. So when we look at the sensitivity and specificity and the answer to the question, does the test work? Part of the answer and why the test works so well is that it's testing for a very specific protein that is only produced when the cow is pregnant or has been pregnant. What do PAG values look like throughout gestation? So the days post-breeding down here in the left-hand corner of the chart, and this dotted line up through the middle of these bars, that is the average PAG value, and this is with our test, with the IDEX test, so this is an S-N value. That is the average. There are over 300,000 cows that went in to make up this chart. This is from the Danish Milk Recording Scheme, and the top of the bars is +1 standard deviation of the mean, and the bottom of the bar is -1 standard deviation of the mean. That incorporates almost 95% of all the cows that were tested. So when you look at this curve, you say, well, what's so important about that? Our cutoff is at 0.1 for yes versus no, as far as pregnant or open. So when you look at that chart, it shows you that there's going to be a very good agreement between if the cow is pregnant and if she shows up as pregnant. So what are the options for pregnancy diagnosis in cattle? We just talked about PAGs. They're on the bottom. Probably the most popular right now is either rectal palpation or ultrasound. There's advantages of it. It's real time, and if the pregnancy has evolved far enough, i.e. about 50-ish days, if the operator is trained to do this, they can actually determine the sex of the fetus and determine if there's twins, etc. The disadvantages are it's labor and technically intensive, and just the fact of palpation alone has been reported to be disruptive to the pregnancy. Now, the one thing, the other disadvantage here is the cost of the machine. I need one of these for research purposes, and I was looking at a used one that was in the $25,000 range. So while it provides some very good information, they're expensive machines. And also remember, they were designed for diagnostic purposes, and we'll get into that here in a little bit more later. Progesterone, ECF, estrone sulfate. These are what they call the hormone-based pregnancy tests. The problem is that hormones are present in the normal estrus cycle of the cow, whether that animal is ever exposed to semen or to a bull at all. So you can have positive tests with these types of assays, whether the cow is pregnant or not. So it takes serial. You have to take multiple tests at certain time periods to decide whether or not the positive test is truly a result of pregnancy, or is it just a result of the enormous estrus behavior. Again, the advantages of using PAG testing or sample-based, milk, serum, blood. We have all of those different options here. is that it is extremely pregnancy specific, and it's an extremely safe sample and easy sample to get. I trained my nieces, they're twins, when they were 12 years old, to draw blood on our beef cows, and they did really well at that. They didn't do so good in school, but they did really good at taking a blood sample. So it's easy to train, and it's a very accurate test. Now, I said it's an indicator that the animal is pregnant or has been pregnant. And so this is 28 days post-breeding, or days of gestation on the bottom axis. And the red line going down through here is pregnancy loss in lactating cows. And this comes from a study that Dr. Vasconcelos did. He is Brazilian, a fabulous researcher, a great collaborator. And this data has been repeated multiple times, but he always gets the credit. If you look early on in gestation, the likelihood that the animal is going to lose that pregnancy is much greater than it is from about day 98 or day 100 on out through the end of gestation or at calving. So that is why that most of the pregnancy testing that's done to make sure we catch those cows in the open state early is done early in gestation, because that's when they're most likely to lose the pregnancy, and that really fits in with sample-based pregnancy testing, especially milk, because if you're taking a normal once-a-month DHI sample, you find out the cow is bred here at about 28-30 days after breeding, and then 2 or 3 times in between there and out here at about 100-120 days of gestation. Real easy to have those DHI samples just include doing a pregnancy test. The sample's already been collected, and all you have to do is request the sample to be run for pregnancy, and you get a confirmatory test. It couldn't be any easier than that. It reduces lockup times, and it helps identify those cows that have lost those pregnancies, so we can make a good decision on whether or not we resync them, or if for other reasons we decide to put them on the do not breed list and they exit the herd. So it makes the ease of not having to lock up cows and repalpate them to confirm their pregnancy. It takes some of that pain away for the cow and for the person doing it. So milk pregnancy. You know what we're testing for. You kind of see why we're doing it and why it works out so well with regular sampling times like DHI samples. So what does that all translate into? Extremely accurate. The pregnancy test, all of the PAG tests, whether it's blood, milk, whole blood serum, extremely accurate. We're in the 98-99 percentile of sensitivity, and that it's the best, most accurate methodology available. It is more accurate than ultrasound, even in the most well-trained hands, with a lot of time to be careful and be very accurate in your determination with ultrasound. The PAG testing is still more accurate. Timely results, trusted. Our test takes, the different methodologies take anywhere from 20 minutes to about 2 hours to get results back. That's once the test starts. So if you include a little transit time back and forth to the lab and results back to you, many people like Central Star are providing next day results. Expanded testing options. There's a lot of things you can do with that milk sample besides regular DHI testing and pregnancy, but those are clearly the two most common things. As much as I like to talk about identifying pregnant cows, the pregnant cow is not the problem on the farm. It's the open cow that's the problem. And so that is where the brand name Alertus comes from. It's a mush together of two words, and it comes from saying our test provides an alert list for animals that are open, and letting producers know which cows are not pregnant so they can take appropriate action as early as possible. And the earlier you get with other methods, the less accurate they become. With PAG testing at 28 days post-breeding, that's where we get our 98.7, 98.9, basically 99% accuracy. Some comparative reference, and I show you this to let you know that our test is extremely accurate, and it's extremely consistent, and it really doesn't matter which methodology you want to pick on your farm, whether it's the milk pregnancy test up here on the top. This is ruminant pregnancy. This is the laboratory-based blood or serum test. This is rapid visual. It's the same test as right here, but you can read it visually. It's got a color indicator. And then our most recent introduction is a whole blood on-farm lateral flow individual cow pregnancy test. Oops. And these numbers are not different. Now, I'm not picking on my profession down here, but this is one of the better studies done in real-time dairies where we have 10 plus years of experienced veterinarians out on farms, and this is what they did. This was their profession. They did herd checks. And the reason there's a spread there is because they were a lot more accurate in the mornings than they were in the afternoons. After they've done 400-500 cows in a day, their arm starts to get tired, and they start to have other things on their minds. And so what I'm saying here is we need to use our veterinarians when they're fresh up here, and that means using tests like this that don't get tired to segregate off the pregnant cows and use the ultrasound. Remember, it was originally designed to be a diagnostic tool, and our veterinarians are taught to be diagnosticians in school. And if we can segregate and reduce the workload on those veterinarians, they get a whole lot more accurate with what they're advising us on to do with the cows. So that's kind of how it works together. This is an idea. It's a little bit conceptual here, but we got P1, P2, and P3. And if at that P1 check that cow is pregnant, we don't need to palpate her. Okay? We let her go be a cow. And we know the correlation between dry matter intake and amount of time the cow spends lying down equates to higher milk production. That doesn't always jive with 4-hour lockup times. So there's several veterinarians now that have come out very adamantly about the more we can reduce lockup times for these cows, the higher their milk production gets. And we'll hear from a Jersey producer here in a video segment in just a little bit. P2, if that animal is pregnant on P1, but when you check her in a P2, this is a confirmatory test, great place to utilize a DHI sample. If she's open, then you've got the opportunity to enroll her in a sync program. But really, here's where the combination of PAG testing and veterinary involvement intersect. That veterinarian can do an exam and many times can make a diagnosis as to why is that cow open. She was pregnant here, but now she's not. So why? It's not always a disease. Sometimes it's just a physical abnormality, something that happened from the previous calving. I've actually seen them where they have ovarian issues and they just need to be on the D&B list. Don't forget that cull cows right now have an average value at the livestock market of about $1,000 a piece. So that makes these decisions very important to the financial health of the operation. So as long as the cow comes back pregnant again at P2, confirmatory need, the only thing that you would need to do a transrectal ultrasound here is if you would manage the cow different, if you know if she's carrying a heifer or a bull calf, or if you know she's carrying twins. This P2 is a real good time to use your ultrasound if you would manage the cow differently. If you wouldn't manage the cow differently, regardless of the sex of the fetus or twins or not, we don't need to do anything else to her. We let her go on and go out and be a cow. And then I list P3 in here. That timing is kind of up to the individual farms, but I will just share from experience. It's real disappointing to have a cow that's P1 and P2 pregnant, and then we skip P3, and she winds up at the end of the dry period and is open. I don't like the second highest cost right now, or first highest cost maybe here in the near future, on a dairy is feeding the cows. So it's really disappointing when you feed an open cow through the dry period and you have that to deal with when we could have gotten rid of her as soon as she finished milking. So, but that's one of those deals where you kind of got to make that decision how you do that, and obviously sample-based pregnancy testing is a pretty good option. This is a customer of ours, Brandon Beavers at Full Circle Jerseys, and y'all have listened to me enough. So, Michelle, if you can give me a thumbs up if the audio comes through on this when I start Brandon's video. If not, we'll just skip it. Two things that Brandon really has brought to light and not been bashful at all about saying is everything that relates to the time budget of the cow. And the more time that cow spends eating and laying down and making milk, he sees an increase in milk production. Now, I know they're jerseys, but pretty important dairy breed for the U.S. He was seeing about 1.5 pounds of milk flow increase per cow per day. Now, on energy-corrected milk, that's about 3 pounds per cow per day. That's simply by doing less with the cow and letting the cow go be a cow. So, kind of summing up here, the benefits of milk pregnancy testings, the big one's less handling and less stress for the cows. That also turns into less stress on the employees. I consider the veterinarian as an employee. I'm going to get to replace my left knee here in the next year or so, and it's because of 4 or 5 cows when I was in practice that seemed to be just dead on target for my left knee. I would have really appreciated if we would have, and those cows always seem to be pregnant, if we would have had a test like this when I was in practice, and I wouldn't have had to be behind those cows. Because they were already pregnant. I could have went over and spent my time trying to help my customers and my clients understand why certain cows were repeatedly open and what do we do there. So that comes down to kind of the next little thing, this open cow detection throughout gestation. We did a study in the UK and we worked with veterinarians that did the P1s, and then we used DHI samples for P2s and P3s. And between about day 30 of gestation and day 100 of gestation, on average, we found about 6% of the cows had lost their pregnancy. The additional testing cost around, it was British, so it was about $4 in real U.S. currency per cow, so $400 per 100 cows, and we were finding about 6 that were open. About half of those were at the point in lactation where they could be resynced and rebred. The other 3 were identified as do not breeds. The return on that $400 investment for the producer turned out to be about $3,800. That's almost a 10-to-1 return on investment. If any of you have looked recently at your fertilizer bill or your forage bill right now, I really don't think that increase in the cost of those inputs is going to have a 10-to-1 return on investment. But making sure that you don't feed open cows long into lactation, that pregnancy test has almost a 10-to-1 return on investment. So finding those open cows throughout gestation is extremely important. Streamlined employee training. Had a customer that I've known for years. They are in the desert Southwest, and their head ultrasound technician on a 10,000 cow dairy, when they came home from vacation, was gone. He had went home, and he took their ultrasound unit with him. The problem is, home was in Guatemala, and it's really hard to prosecute someone for stealing your ultrasound unit that's now residing in Guatemala. In 2 days, we had 8 people on their dairy that were trained to either take a blood sample or a milk sample. And there was no piece of equipment for them to break or take home at night. They simply learned how to draw blood. And honestly, by about the third cow, 99% of people that are taught how to draw blood properly out of the tail are experts on their third or fourth cow. And if you've got people working in a dairy that don't know how to take a milk sample, you need to find them another job. The last thing, this improved reproductive performance, finding those cows that didn't conceive or did not keep the pregnancy as early as we can and take steps to change that status improves our reproductive performance regardless of how you measure it, whether it's by shortening that calving interval, shortening days to open or days to pregnant, getting that cow bred earlier in lactation. All of those things really change your reproductive performance, which translates into more milk. I just finished a project with Texas A&M, one of the researchers there, and it's been a project over about 12 years. And we looked at cows. It was a beef cow study, so bear with me. But we looked at cows that bred on the first service, AI, when they were heifers. And if those cows stayed in the herd and had 6 calves, just by the fact that they would rebreed earlier in the breeding season, have the calf earlier in the breeding season, those 6 calves equated to actually 7 calves, weight-wise, of the cows that bred on second or third service. So second service would be a rebreeding, third service in the beef industry is a cleanup bull. So those same cows that got bred later, in this reference, you could say later in lactation, they don't produce as many pounds for you as cows that breed in the first service. And we have a whole lot of heifers right now because of sex semen, and we have the opportunity in the dairy industry to change our mindset about how many chances do we give these girls and how rapidly can we improve our genetic merit in our herds. And we know that cows that get settled early on or settle in that first service are much more likely to also get settled first service-wise the next time. So those heifers that you're looking at and trying to decide which ones do I keep, which ones do I sell, think about only picking from the ones that breed on the first service, if that's possible. And for sure, don't keep any in your herd that don't breed until third lactation or third service. Those are the heifers that need to be sold as commodities. If you have extras and you always want to keep the best for you, and sell the ones that you wouldn't want to milk to your neighbor, because it's always a competition between you and your neighbor at the bragging table at the cafe downtown. That's just, sorry. I know everybody's got neighbors that they love, and I do too, but I like to keep my best cows. So, Michelle, I'm going to stop there, and hopefully we've got some questions. I'm going to stop sharing, and hopefully we've got some questions. I'd rather answer their questions or your questions than keep talking.
That was great. Thank you very much, Dr. Rhodes. I really appreciated everything that you shared. It was very informative. So I do have a few questions, but I want to open it up and see if we've got anybody that would like to just talk and chat with Dr. Rhodes and ask any questions. It looks like I do have one question that came in through the chat, actually regarding goats. Says, what are the same inflection points for Nigerian goats?
Ooh, Nigerian goats. I'm going to claim I don't know there, but what I can tell you is their dip point, like we saw on the Danish milk recording scheme chart, it's not as pronounced. Okay, and I don't know about Nigerian goats. I've got a lot more experience with Boer goats, the meat goat section, and the blood pregnancy test and in the lab that you all do, Michelle, and then also the rapid visual pregnancy test we know they both work for goats, for the caprine species. I don't know that we've got a whole lot of data on the Nigerian specific goats, but what I can tell you is all the breeds that we've looked at to date on the cattle side. And remember that cattle have both Bos taurus and Bos indicus. We've got two different species in the cattle side. And the polyclonal antibody detector that we have in those two tests does have shared epitopes for goats, sheep, American bison, and water buffalo.
Okay. It looks like there was a follow-up about those with goats having or the Nigerians having a 150-day gestation. What are the points to do a P1, 2, or 3?
Much quicker. There, a lot of this P1, P2, P3 timing, while the P1 is still going to be, I wouldn't do it much earlier than about 40 days in the goats. Some of them, their implantation timing can be a little different, and the placenta has to marry up to the uterus for PAGs to spill over into the maternal circulation and our test to pick them up. So that's why we have that 28-day restriction. That really doesn't happen until 24 and 28 days. It can be in some goats, and it seems to be kind of individualistic, a little slower. So that P1, I would be more comfortable if I was the practitioner advising on this to have that out more in that 40-day range, okay? Now, the P2, as far as looking at embryonic loss in the goats, I would probably be looking at that if they did it at around day 40. I'd still be looking in that 75 to 80-day range. It's a little shorter, but the length of the gestation is different. And the goats have such a minimal amount of embryonic loss beyond about 75 days that economically, I just don't know that I can recommend a P3. Just being super honest with you, I don't think you can justify the cost. So you get a P1 and so then the P2, 75 days is about right. But if you're only going to do 2 and you want to move that out to about 100 days, that's going to be kind of an individual choice there. But the other options of trying to find out if a goat is pregnant, in my hands, in my practice, when I was in practice, wow. In 2010, when this became available and it had a goat label claim on it, I mean, it was just positive for us and our producers. So yes, so 40 days and then about 75 to 100, absolutely. That's how I would do it. Yep.
Wonderful. Thank you.
Man, that's a good question. That was
Yeah,
a professor there.
right. Um, so one of the questions that I had was you kind of touched a little bit on twins when you were talking about the difference of when you should do an
Yes.
ultrasound versus the other tests. And so one of the questions I get quite frequently is, can the test, milk pregnancy test, actually diagnose twins? Can it tell me if there's twins in there?
Yeah. So the academic question is yes. The practical question is no way. Okay. So at A&M, where we're running multiple standards with every sample that we put in there, yeah, because there is usually larger placental mass, and we can get an indication that there may be twins. It's not pathognomonic. It's not diagnostic. Okay. In a normal commercial setting like you all have, where you've got one sample and you're running one sample per cow, no, absolutely not. And I wouldn't trust it even if you were running standards. So right now, where we're at in a commercial setting, no, no.
Is that something you think the research is going to move towards?
Yes. Unequivocally, yes.
Right.
And also, um, the whole thing about the sex determination. I think we're gonna get to the point where we can determine sex of the fetus with PAG testing as well. But I will caution everyone on that. I started working in this field in 1990. Okay, in PAG testing at the University of Missouri, which is where most of this IP comes from. It was finally brought into a commercial assay in 2010. So I don't know if I'm going to live long enough to see those advancements.
Mhm.
But we, Kai Poehler and Matt Lucy and Paul Fricke have tools now at their disposal for research that we didn't even dream about in 1990 and early 2000s. So, I'm the eternal optimist, and I do think there are markers there. That's not in question. That can identify sex and can identify twins. Getting them into a commercial assay that isn't $150 a test is a challenge.
Right. So along the same lines of kind of what else you can learn from that information, does the test value have any correlation to how far along she is? As far as, if I get a test value, can I definitively say that means she's 150 days carried calf?
You saw the chart that I showed, and so PAG values increase as gestation progresses. We just published a study, or we submitted it for publication out of with Dr. George Perry and another grad student, Adelaide Klein, and we looked at that, and our objective was, can we divide into trimesters? So kind of like they do at the sale barn. This is a first period cow, second period cow, third period cow, not to be confused with P1, P2, and P3. And about 60% of the animals that we tested, we were able to correctly put them into trimesters.
Mm-hmm.
That's just slightly better than the flip of a coin. So,
Right.
yes, there's an indication there. Is it useful? No, probably not. And would I bet on it? No.
Right.
Not at all.
Right.
There's too much individual variation, and actually, two collaborators at Central Star and I worked on some genetics work that was published in 2018 that showed that actually the bull has greater impact on the magnitude of PAG levels in individual pregnancies than the stage of gestation or the cow. So there's a lot that we still don't know about magnitude of PAG levels. So I wouldn't, even though the general trend, and I think someday we will get better at identifying those. But right now, I would not use that as a way to age the gestational timeline.
Okay.
Great, man. These are the kind of discussions that usually keep me from eating dinner at night. I just keep discussing and discussing it. So much fun. I love the questions. Keep them coming.
I've got a couple more, but we'll take a second to see if anybody else had any. Like it. Okay. So another one I had was, what are some of the things that can cause a recheck result in a milk pregnancy test specifically?
Yeah. So the most common issue is embryonic loss, and whether it's my arm in an ultrasound or a PAG test, um, the embryo can look normal but be on its way out. And in early pregnancy, that animal, when she loses that pregnancy, she will be positive on the test, but the value will be declining for somewhere around 5 to 7 days. So that recheck level is at zero point 0.1 to zero point 0.3 on our test. So it's way down there. And you don't know if that cow's lost the pregnancy and is declining, or it was her breeding date recorded wrong, and instead of at 28 days, she's actually a week early and she's at 21 or 22 days, and her level is just starting to climb. So it's not an inaccuracy in the test. It's actually the test letting you know that, hey, this cow is out of the range where we expect her to be for this point in gestation. And Jonathan Stratham, my collaborator in the UK, he said those cows need to go have someone lay hands on them. And so that is kind of where the veterinary involvement, if available, becomes really critical, because that can also indicate a problem with the pregnancy. Because if the uterus and the placenta are not measuring or matching up real well, you're going to have a lower than expected PAG level in the maternal circulation for where you would expect that cow to be in the gestational timeline, because you would expect it to get higher as it goes. And so things that happen there, mummified fetuses, abortions that are starting to happen, whether it's IBR or something I haven't seen in quite a while, but when we first started using modified live IBR vaccines in pregnant cows, we saw this a lot, and it would show up in our pregnancy test as a recheck. And so the rechecks are a window into what's going on in the cow. I see higher than expected rechecks in early gestational checks in those P1s. When we had the extreme weather event last February, when most of the U.S. froze, the 3 weeks after that, we had a lot of rechecks on cows that were previously checked pregnant. And it was because they were losing their calf. And so if you see more than about 8 to 10% rechecks on any given report, be looking at some reasons. It could be nutritional. It could be disease related. It could be heat, environment related. It can also be, I just unloaded a new load of cows from this other dairy over here, and they spent all week last week trying to decide who was boss. Okay. We've all seen that, and we've seen the cows, and they're throwing their heads around at each other, and occasionally that causes a few of those cows to lose their pregnancies. So the recheck value is telling you that either she's losing that pregnancy or there's a problem with it. It's not that the test doesn't know how to classify her. It's just that if she's in that zone, somebody needs to go pay extra special attention to that cow. And even if all it is you put her on the preg checklist for next week. Let's see where she's at next week. If you got SCR collars, you check her how much movement she's had during that week. It just means it's identifying that cow. Pay a little more attention to her. Once again, those cows that are pregnant, let them go be a cow.
Right.
Those that
right.
are open or recheck, we need to pay a little more attention to them because they're the ones that are going to cause us a financial hardship.
Right. So along those lines, would you say, you brought up bringing in hands to check those cows, so it's probably a veterinarian. Would you say that you are seeing more acceptance by the veterinary community to this test or not yet? I know one of the things that I get a lot is customers say they don't want to try it, not that they don't trust it or even that they don't think it'll be as good as the vet, but they don't want to upset their veterinarian. They think that the vet will get mad at them. And
Absolutely.
so what are you seeing in the industry?
Can I blame my generation? Your generation, Michelle, is a much more willing to work in kind of a hybrid environment.
Mm-hmm.
Those of my generation that have made their living arming cows are a little more resistant to it. So I'm not going to say I can make a veterinary statement in general, but what I can say is veterinarians that want to do this are all in. And I was at the University of Missouri Wednesday evening last week, and 16 young soon-to-be veterinarians, and when we talked about segregating cows so they could focus on the cows where they have the biggest impact on the farm, that's the open cows. It's not the pregnant cows. The ones that get pregnant, first service, second service, let them go on. And one of the young vet students that was sitting right in the front row, her dad happened to be my classmate. Didn't know that until later. And she said, this is great for me. I'm going to recommend this because I want to still be practicing when I'm my dad's age. And her dad's had 2 broken arms and had a shoulder repaired, and he just can't palpate anymore. And she's going to go home and join the practice. But she said, I don't want to have that pressure on me that if I get hurt, our customers no longer have a veterinarian. And she said, this is great. I can segregate the cows and I can spend my time working with the cows that actually need a diagnostic test, not a yes/no. Okay. Now I'll throw another one of my classmates out here that told one of his customers, if you go to sample-based pregnancy testing, next time you need a DA cut, next time you have an OB, a calving difficulty, sharpen up your knife, get your chains out because I'm not coming. I had a little discussion with my classmate about that. And he wasn't, we had to agree to disagree. And I said, well, I hate to tell you this, but there's 3 other veterinarians down the street to one town over that are probably going to pick up your customer. And so I remember when ultrasound was first introduced, and there were a lot of veterinarians that said, nope, my arm is so good, I'm not going to buy that machine. Well, now Dr. Paul Fricke sent me a bumper sticker that he saw that had a veterinarian holding an ultrasound, and it was someone about my vintage, and the caption said, you can have my ultrasound when you pry it from my cold, dead fingers. And I don't know if I resemble that remark, but we're attacking some veterinarians' way of life. And we've got to understand that, and veterinarians are a little resistant to change, but we also are producers. I'm a producer, and this is the way of the future. From an animal welfare standpoint, from a human welfare standpoint, and it's going to increase our efficiency to be able to get these pregnancy tests done earlier. 80% of the beef herd in the U.S. doesn't use pregnancy testing at all. Mm-hmm. That's just, if you want to point fingers where the most efficiency gains can happen, right there it is. The dairy industry is way ahead of that. But we're looking at, in the dairy industry, instead of pregnancy testing once a month or once every 2 weeks or once a week, I was on a farm that just installed 250 lay robots over the last 2 years, and they are programming the robots, and they take the sample on day 28 after AI. They're doing pregnancy testing every day. That has changed their days open. It has changed their calving interval dramatically. And guess where those cows don't spend their time waiting on the veterinarian to show up? I will be late to my own funeral, okay? That's just a dream, it seems like, in large animal veterinarians. We're going to be late to everything. And the poor cows have to wait in the lockups. Well, whatever we did that was so important that we couldn't get there. And it's always important. I mean, just ask the veterinarian.
Right.
So, you know, when we think about being able to increase efficiencies, this is the way that the future is going to go. And there are veterinarians that are embracing this. They tend to be a touch younger than me. and I love them for it because they're the future of our profession.
Great. Thank
Much
you.
answer there, but
No, it was great. It was great. I would have to say I see similar trends. Although I will also say I see also in the very close to retirement group saying, yeah, go right ahead, because they've already had the shoulder surgery and the hip surgery and all the other surgeries to repair all the damage, and they don't want to keep breaking their bodies anymore. So,
you know, it's a really sad statement when you're, you know, getting out of school and you got school loans to pay for and you want to start a family, and it's not really a matter of whether or not you're going to get hurt, it's when and how bad. And if we can reduce the amount of opportunities for a cow to get you, it statistically increases the how long that person's going to be able to practice. And we're not making enough food animal practitioners that are willing to get behind a cow to begin with. Taking steps as a profession that needs them, and I say that's the dairy profession, anything that we can do to extend their practice life, they become a part of the farm, a part of the family. And the more we can do to keep them around, I think long term they're going to appreciate it.
I agree.
We'll see if I'm right.
I agree. We'll be watching.
Yep.
I just want to remind you that if you would like more information, you can reach out to any of us. You can also talk to your trusted Central Star representative, or if you're ready to just go ahead and get started, give them a call, let them know that you're ready to go. And then as a little bit of an update, so as I mentioned at the beginning, this is a webinar series, so we do intend to continue this. We plan to do them roughly quarterly with new content, and the next episode is expected to take place mid-July. So if anybody is interested in getting registered now for that, feel free to respond to the email that sent you this invite, and I'll add you to the list to get you added to our next episode. And then just to wrap it up, I just want to thank everybody for joining us, and I hope to see you next time.